Welcome to Toledo Clinic TV. Our guest is Dr. Naeem Lughmani. He is a sleep disorder specialist. Thank you for being with us.
You're welcome.
In the next couple of minutes, we're going to cover 3 different topics, and I know you deal with a wide variety of sleep disorders, but we're going to talk about insomnia, something called REM sleep behavior disorder, and then also restless leg syndrome. So let's tackle insomnia first. It's probably one of the more common things you see in your practice. How common is it, and what can we do about it?
Insomnia is an extremely common sleep disorder. It's almost anybody experiences it, at least in their lifetime. It becomes a problem when it becomes chronic. So you can divide insomnia into 2 basic categories. One is acute insomnia and one is chronic. So acute basically usually have a reason. So you have somebody close to you died, you got separated, you suddenly got diagnosed with an illness. So that will trigger insomnia. So that's critical to identify that they have acute insomnia secondary to something so that you can manage it appropriately. If not, if you don't manage it right away, then it can, in some percentage of people, can convert into chronic insomnia and becomes more of a challenge. There are other things you have to realize in people who come with insomnia or you develop insomnia. There are some comorbid conditions or risk factors which needs to be looked at. People who have depression, for example, people who have anxiety disorder, people who have other diseases for which they are on certain medications they go on that can trigger insomnia as well. So they're more likely to get insomnia, like stimulants. If some people are on like stimulant medications, certain antidepressants can actually make you have insomnia as well. So you have to look at those. Certain diseases, for example, can make you have insomnia, like restless leg syndrome. It's not the insomnia itself, it's not that they can't fall asleep, but they have this problem that makes them not fall asleep. Chronic pain syndrome, for example, people with back pain, shoulder pain, they just can't sleep because of that. So there is a multitude of different things that are involved in insomnia. So it's not just insomnia. A lot of time people say, okay, I can't sleep, just get a sleeping pill and I'm going to sleep. So no, you have to really find what the cause is. Is it really acute insomnia versus chronic? And is there any comorbid conditions and other things which are triggering it? And then you can, if you identify the real problem, then that can be solved.
Is there a population in particular more at risk, say as you get older, or women more likely or men more likely?
As we get older, the insomnia does get common, partly because of certain other diseases like chronic pain, arthritis, mood disorder. There are certain conditions which causes insomnia are more common in women than men. For example, restless leg syndrome is a little more common in women, and that can also trigger insomnia. And there are certain other things, for example, comorbid sleep apnea is more common in men, so they'll have more likely to get insomnia from sleep disorders if that is what is causing it. So yes, there are some risk factors, as we talked about earlier as well, which can trigger insomnia, and we have to be cognizant of that.
Yeah, you talked about restless leg syndrome a couple of times. What is that exactly?
Restless leg syndrome is a symptom-based diagnosis where patients who do develop it, they feel this urge to move their legs, this uncomfortable feeling in the legs, and sometimes also in the arms, where you just can't stay still. And if you move, you feel better. If you stay still, you get worse. It also gets worse later in the evening. So the more later, like near bedtime, it starts to get worse, and that's what causes insomnia. So it is relatively common. About 10 to 15% of people may have restless leg syndrome. There is another disease associated with restless leg syndrome, which is called periodic limb movement disorder, where you also get this leg twitching when you're sleeping, and that can disturb your sleep at night too. In those cases, it's not just insomnia, they get sleepiness in the day too because their sleep is poor quality.
Is there a treatment for restless leg syndrome?
Yeah, so that depends on the cause too. Restless leg syndrome, because of the cause, it's more common in women because women are more likely to get anemia, iron deficiency anemia. So iron deficiency is a very common cause of restless leg syndrome, and people who don't have iron deficiency, they have iron metabolism problem. They have done some research, found out that even though they take iron, it doesn't get absorbed as quickly or is not effective in the system in the neuron, so you feel that urge to move because of that. So there's something to do with that, and there's another neurological system in the body. I don't want to go into details, called dopaminergic system, and there is defect in that too, which causes us to have restless leg syndrome. So because of those mechanisms, the treatment is, if you're iron deficient, you take iron pills or iron infusion. Once that is fixed, then you start feeling a lot better. If it is not, then there is dopaminergic agents. There's dopamine agonist medications. There is Mirapex, and there is other ones, Cinemat, and blah, blah, blah. So they can be used, they can help quite a bit. If that does not work, there is another category of medicines that can help.
Okay. Important
thing is to find out the cause. I mean, there are certain other things too. I mean, these are common, but people who have kidney disease, for example, if they get a little uremic from kidney disease, they have restless leg syndrome as well. People with neuropathy, sometimes they have associated restless leg. Arthritis patients can develop restless leg syndrome. So there are other things which can produce these symptoms, and once you identify that, then you can treat that.
The important thing is to get evaluated.
Talk
to your doctor about it. Yep. All right, REM sleep behavior disorder. What is that? It's not as common, I think, as the others.
Yeah, actually, REM sleep behavior disorder is quite common. It's about 1 to 1.5% of people have it. They just don't come up with it. Nobody talks about it. It is more so as we get older. Basically, it's dream enactment. So whatever you're dreaming, you act your dream. And a lot of times the spouses do not want to come up with it, that their husband is beating them up or moving around and start talking and falling off of bed. So these are the symptoms. So what happens is that in a dream sleep, in order to protect our body, we call it REM sleep atonia, which means that in REM sleep or dream sleep, our muscles get paralyzed basically. So from neck down, we cannot move our muscle. So whatever happens in the brain when we are dreaming does not get transmitted to the body, so you don't move. In patients who have REM sleep behavior disorder, that process does not work really well. So whatever they're dreaming, it goes through the brainstem into your muscles, and you actually starts doing it. So people, if they have a scary dream, they're running away from some bandits, they're running around and they just get off the bed and bang into the wall, because since they're in dream mentation, they don't know where the door is. For their door is their dream door. So they might bang into the wall, a sharp object. They, a lot of time, hurt themselves. They've come with bruises. And if there is mild, they just talk and move around, maybe hit their spouses. Most of the patients are like that. And then eventually somebody brings them in, and then we do a test and find out if they have REM sleep behavior disorder, because it can really hurt them or their spouse.
It sounds like it. Is it easily treatable?
It can be, yes. So that also depends on the cause. Very commonly, I would say half of the patients maybe are neurodegenerative disorder, where our nerves are getting little old and damaged, and sometimes it is related to Parkinson's disease as well. It could be the early symptom of Parkinson's disease, Lewy body dementia, this type of dementia. It could be early harbinger of that. So not that people should get scared of that's what they have, but a percentage of these patients have those diseases coming up. So that is causing their nerves to degenerate a little bit, demyelinate, and they cannot, that paralysis does not work. In other patients, it's just a symptom. For example, for narcolepsy, it's a symptom of narcolepsy. It's very common in narcolepsy too. So you treat narcolepsy, you get better. Sleep apnea is common that too. But in that, it's not neurodegeneration. It's more like waking up just at the wrong time from an apnea. You're right in the middle of dream, and then the dream can get through to your muscles. So then you treat that, and then you feel better. Also, some antidepressants, some other medications can do it too.
Okay.
So depending
sleep
on
is complicated.
Yeah.
Sleep is very complicated. Thank you so much for being with us.
You're welcome.